Let us go to etiology and Chinese medicine. The topic is stones. Stones are formed when turbid dampness and heat accumulate in the body and are heated for a long time. The most common stones are those of the stomach, the gallbladder, and the kidney. Stones are the result of certain pathological processes, but are in turn causes of additional illnesses. Now let us look at the formation of stones. Unbalanced dietary preferences. Chronic unbalanced preference for greasy and sweet foods or indulgence in alcohol and milk can affect the digestive functions of the spleen and the stomach. This leads to the generation of endogenous dampness and heat, which accumulate in the liver and the gallbladder. They form a mass in the gallbladder, and after a long time, it transforms into a stone. If dampness and heat lodge in the lower jiao and disrupt qi transformation, they may turn into stone in the kidney. Inappropriate diets. Eating too many persimmons or dates on an empty stomach, especially if raw or not peeled or with seeds, can interrupt the stomach's decomposing and descending functions and lead to stomach stone. Also, in some localities, the quality of the water supply may also contribute to stone formation. For example, regular drinking of very hard water can lead to kidney stones. Next is internal injury by passions. Disharmony of mental activities and passions and stagnation of liver and gallbladder qi can disrupt the liver's facilitation function and the smooth secretion of bile. Mixing of bile with dampness and heat for a long time can lead to the formation of gallstones. Next is erroneous herbal medicines. Long-term intake of medicines containing calcium, magnesium, or bismuth can affect the stomach's decompositions of foods and downward transportation of chyme and lead to stomach stones. Long-term intake of certain alkaline medicines or mineral medicines can affect the transformation of kidney and bladder qi, causing impeded water flow and kidney stones. Now let us look at the characteristics of stone-induced disorders. Stone mostly affect the fu organs. Though kidney stones are seen clinically, most often they are gallbladder stones, stomach stones, and urinary bladder stones. The reason is principally because all 6 fu organs are hollow and convenient locations for stones to form. Prolonged course and varied symptoms. Stones form from stagnant qi and blood due to dampness and heat. Apart from stomach stones, the others form after a prolonged course. Clinically, the symptoms vary considerably depending upon the size of the stones and their location. In general, small stones tend to cause milder symptoms, sometimes even without symptoms, whereas large stones tend to cause more severe symptoms. Ready blockage of qi movement and injury of meridians. Stones have material form. As they lodge in the organs, they readily impede qi movement and actions. This in turn affects the circulation of qi and blood, the metabolism and transportation of food and drink, and the excretion or secretion of fluids. Stones in the stomach, for example, can inhibit stomach qi movement and affect the decomposition and transportation of water and grains. The stones may even pass down to the intestines and cause blockage there. Stones in the gallbladder can affect the conducting and dispersing function of the liver and gallbladder, and the normal excretion of the bile. Stones in the kidney and the urinary bladder can lead to disturbance of water metabolism. In addition, stones may damage blood vessels and cause bleeding. Colicky pain. When stones lodge inside the body and affect the free movement of qi and blood, in general, there are regional distension and pain. When a stone blocks a passageway, severe colicky pain can develop. For example, gallstones can produce severe cramps in the right flank, which radiates to the right shoulder. Kidney stones can produce severe cramps in the waist and pelvic abdomen, which radiates to the insides of the thighs. During attacks of these cramps, the pain is difficult to withstand and is often accompanied by cold sweats, nausea, or vomiting. Phlegm, rheum, blood stasis, and stones are material products of pathological processes. They share the characteristics of blockage of qi movement and prolonged course and a wide variety of symptoms. There are differences, however. Phlegm and rheum flow with qi and blood throughout the body, and their effects are diverse and unpredictable. On the other hand, though blood stasis and stones can occupy different locations and show varied symptoms, the pain of blood stasis tends to be sharp and stabbing, whereas the pain of stones tends to be colicky. Thank you so much for your attention.